Diabetes mellitus is a chronic endocrine disorder characterized by persistent hyperglycemia due to insufficient insulin production and insulin resistance. It's the most common disease in dogs and cats. The most common form of diabetes in dogs resembles type 1 diabetes in humans. Most common form in cats resembles type 2. Lifelong disease requires technician involvement, and early detection improves outcome. Normal glucose physiology. The cells of the body require full fuel in the form of fat or sugar to conduct their daily activities. Diabetes mellitus mostly involves the metabolism of sugar, in particular a sugar known as glucose. Glucose comes from the diet and forms of starches and sugars that we eat. Tissues cannot absorb glucose without a hormone known as insulin, which is produced by the pancreas as part of the body's natural blood sugar regulation. Once inside the tissues, glucose can be burned or fuel or stored, but without insulin, the sugar stays in the bloodstream and cannot be used by the body. With no insulin, glucose cannot get into the tissues, therefore left in the bloodstream in extremely high amounts, causing cells to starve, resulting in hyperglycemia. Two main types of diabetes. Type 1, which is insulin deficiency. Type 2, insulin resistance. Insulin deficiency is common in dogs and often permanent. With type 1 diabetes, the pet's immune system attacks the beta cells. This form can also result from pancreatic damage, such as from pancreatitis. Because the beta cells have been destroyed, the pancreas cannot produce the insulin the pet needs. A variant of gestational diabetes also occurs in dogs. Insulin resistance, type 2, is common in cats, but remission is possible with early treatment. Pets with type 2 diabetes have insulin resistance, in which insulin cannot bind to its receptors. In type 2 diabetes, beta cells remain intact, but the pancreas cannot secrete sufficient insulin to maintain a healthy blood glucose level. A major risk factor in cats is obesity. Risk factors and clinical presentations. Common clinical signs are cataracts in dogs, weight loss, chronic infections, PUPD, lethargy, decreased appetite in cats, and diabetic neuropathy in cats. Risk factors in cats include obesity, neuter males, sedentary lifestyle, and steroid use. Risk factor in dogs is middle age to older, certain breeds like miniature schnauzers and poodles, intact females, or pancreatitis. Technician recognition during routine appointments. If you notice an increase in the owner refilling the water bowl, the owner noticed larger urine clumps in the litter box, weight changes during tech appointments, or a sweet smell to the patient's breath, which is common in DKA cases. Diagnostic approach. Persistent hyperglycemia and glucoseuria is the primary diagnostic indicators for diabetes mellitus. Normal blood glucose concentration in dogs and cats is between 75 to 120 milligrams per deciliters, which is measured after food withholding. Elevated blood glucose levels can result in glucose spilling into the urine. Therefore, detecting glucose in a urine sample may help confirm or indicate the presence of diabetes. A urinalysis is therefore a critical component, simultaneously ruling out other causes of polyuria or polydipsia, such as kidney disease. Differentiating stress hyperglycemia in cats is very important. It is a common problem, and multiple blood and urine samples may be required to confirm the diagnosis. Stress, particularly in cats, can cause temporary elevation. Historical blood work can indicate if a cat is prone to stress hyperglycemia, but if there is uncertainty, a fructosamine test may be recommended. Fructosamine is a protein that glucose binds to, and its concentration reflects the average blood glucose level over the preceding 1 to 3 weeks. Measurement of serum fructosamine concentration can assist in differentiating between stress-induced hyperglycemia and diabetes mellitus. In cases of stress-induced hyperglycemia, the fructosamine concentrations are normal. Blood glucose curves provide detailed information, including glucose highs, lows, and unexpected readings, allowing for more focused and intense data collection. This involves collecting glucose readings every few hours for 6 to 10 hours. CBC and Kim panels is primary tool used for confirmation. A persistently high level of glucose in the blood, hyperglycemia, is the hallmark of diabetes mellitus. In all cases, a thorough history should be taken to rule out exposure to drugs or diseases that predispose to diabetes. Insulin therapy. Common insulin types used in practice include glargine, NPH, which is Humulin N and Novolin N, Vestolin, Prozinc, Degludec, and regular or short-acting insulin. Glargine, which is a longer-acting insulin commonly used in cats, provides a steady release of insulin over 12 to 24 hours, making it a good match for feline metabolism. Glargine comes in two forms, which is a vial or a pen injector. NPH, which is Humulin N or Novolin N, is an intermediate-acting insulin that is used in dogs. Duration of action is often less than 12 hours. Vestolin, which is an intermediate-acting insulin commonly used in dogs, but is also FDA approved in cats, has a close to 12-hour duration of action in most dogs. Prozinc, a long-acting insulin that is commonly used in cats, but is also FDA approved for use in dogs, has a duration of action of 10 to 14 hours. It can have a prolonged duration of action in dogs and may be tried on a once-daily dosing schedule. The Degludec, which is an ultra-long-acting insulin used off-label for diabetic dogs, is often used once a day. Some cases may require twice-daily administration. May be considered when other more common feline insulins like glargine are not achieving desired steady results. And regular or short-acting insulin is mostly used only in a hospital. Proper storage and handling. Most insulin products should be kept in a refrigerator. Humulin N, Lantus, and Prozinc should be gently rolled between your hands before use to mix the insulin without damaging it. Vestolin, on the other hand, is a suspension and must be gently shaken to evenly distribute the insulin. If not mixed properly, the dosage may be inaccurate. There are two different types of syringes that are used with insulin, the U40s and U100. The difference between U100 and U40 insulin is more than just a label. It directly affects how much insulin is drawn into a syringe. A U100 syringe is calibrated for 100 units per ml. If you accidentally use the syringe with U40 insulin, you'll underdose your patient. A U40 syringe is calibrated for 40 units per ml. When used with U100 insulin, it will overdose your patient. There are syringes with half-unit markings if your pet requires very small or precise dosing. Administration techniques and injection site rotation. For pets with diabetes, maintaining a consistent routine is crucial. Insulin should be given at the same time each day, usually every 12 hours. Always feed your pet before giving insulin to ensure there's food in their system. Giving insulin on an empty stomach increases the risk of low blood sugar hypoglycemia. Administer injections under the skin, alternating the sites to prevent soreness. And I have a video.
Your pet is a special part of your family, so learning they have diabetes can be overwhelming, but with proper management, your pet can live a happy and healthy life. Along with diet and exercise, insulin administration is a critical part of diabetes treatment. Your veterinarian will explain the treatment specific to your pet's needs. This includes recommending the type of insulin and the appropriate syringe. It may seem intimidating now, but the process will get easier over time and will soon be part of your daily routine. First, take your pet's insulin out of the refrigerator and prep it as instructed. Clean the rubber stopper with an alcohol swab. Next, carefully remove a syringe from the package and draw the plunger back to the number of units prescribed by your vet. We'll use 10 as an example here. Insert the needle into the vial and push the air into it. This helps keep the pressure in the vial stable. Tip the vial upside down and draw back the prescribed units of insulin. Tap the syringe to remove any air bubbles and recheck that the insulin is at the prescribed dosage. Now, it's time to find your patient. Feed your pet before giving insulin, unless otherwise instructed by your veterinarian, and give them some extra love. With your pet fed, happy, and relaxed, gently pinch up a tent of your pet's skin. Injection locations can be between the shoulder blades or the hip bones. Holding the syringe in your dominant hand, inject the needle into the tent. Once in, draw back the plunger slightly to check for blood. If blood is present, it means the needle hit a blood vessel. Simply pull the needle out and try another location. When it's all clear, gently press in the full dosage and remove the needle. Check the injection spot with your hand to make sure it's not wet, ensuring the entire dose was administered. And give your best friend some extra love for a job well done. Finally, properly dispose of the used needle to ensure everyone's safety. The UltiGuard Safe Pack makes it simple. New needles dispense at the bottom, and once used, they dispose into the top of the container with the turn of a dial. Follow these reminders and your pet will be in great hands. You've got this. On behalf of everyone at UltiMed, we wish you and your sidekick a long and healthy friendship.
Nutritional management. Dietary consideration for dogs include insoluble fiber and simple carbohydrates. Insoluble fiber is vital as it adds bulk and slows digestion. By slowing carbohydrate absorption, fiber helps reduce the sudden blood glucose spikes caused by simple carbohydrates. Prescription options include Purina Pro Plan, Veterinary Diets Gastro EN, Fiber Balance or OM, Hill's Prescription WD or Metabolic, Royal Canin Glyco Balance. Dietary consideration for cats include proper protein intake, which is vital for glucose supply and preventing muscle loss. Diet management should include moderate fiber for satiety and crucially limited carbohydrates for effective diabetes and weight control, as high-carb diets impede management. Prescription options include Purina Pro Plan DM, OM, Hill's Prescription MD and WD, and Royal Canin Glyco Balance. For overweight pets, gradual weight loss is crucial to improve insulin sensitivity, while underweight pets require nutrient-dense, controlled, and consistent feeding to manage the disease. Monitoring protocols. Periodic monitoring throughout the life of a diabetic pet is important to ensure insulin dosing is effectively correcting the patient's hyperglycemia. The vet will recommend appropriate follow-up exams to ensure the dose of prescribed insulin is working and provide close adjustment if needed. Continuous glucose monitoring system like the Libre 3 track interstitial glucose over time, aiding in the detection of nocturnal hypoglycemia and assessing daily trends. These at-home systems are less stressful as they eliminate the need for owners to prick pets for blood samples. CGM systems record glucose every 15 minutes for up to 14 days and have proven generally accurate in dogs and cats, despite not being veterinary calibrated. Because some pets show difference between CGM and blood glucose, especially at low levels, it's recommended to confirm low CGM readings with a blood glucose test. Complications and emergency management. Hypoglycemia is a medical emergency and can occur if too much insulin is given, your pet skips a meal or vomits, there's a delay in mealtime or excessive exercise. The clinical signs include weakness or lethargy, confusion or disorientation, wobbliness or incoordination, seizures, or collapse. What to do if any of this happens? You can apply care syrup or honey to your pet's gums, feed your pet immediately if they are alert enough to eat, or seek emergency veterinary care immediately. DKA, also known as diabetic ketoacidosis in pets, is a life-threatening emergency complication of diabetes mellitus, often triggered by infection or pancreatitis where the body produces high levels of blood acids. Key symptoms include extreme lethargy, vomiting, loss of appetite, dehydration, sweet-smelling breath. Treatment focus on the following: correcting dehydration by administering IV fluids such as saline solution or lactated ringers, decreasing hyperglycemia and ketosis by administering regular insulin, such as humulin R, maintaining serum electrolyte concentration, especially potassium and phosphorus, identifying and treating underlying and complicating diseases, such as acute pancreatitis or infections. The technician's role: teaching owners to perform home glucose monitoring, manage diets, and properly given insulin injections. It includes client education, monitoring hospitalized diabetic patients, as in administering prescribed insulin injections and monitoring for insulin-related issues, and performing laboratory tests such as urinalysis and blood tests to assess diabetic control. Overseeing client communications, scheduling follow-up appointments, and monitoring for clinical signs of hyperglycemia and hypoglycemia is also important. Technicians on the front line of diabetic care, bridging the gap between clinical data and compassionate client communications. And that's it. If you have any questions, y'all can email me.